Hey guys, welcome to another Optimal Health podcast. Today, I've got Rob Sharpe on the podcast. Rob, thank you so much for joining me.
How are we, Ollie? Appreciate you getting me on, buddy.
Uh,
We've been chatting for a while, doing a bit of work together, but yeah, let's
yeah,
delve
it's,
into it
it's
and
been
get into
good.
what you
Yeah,
want to
like,
talk
I'm
about.
glad we connected. You're back in Dubai now, right? Oh, in Greece.
No, I'm in Greece. I'm in Greece. Yeah, I'm in Greece right now. I'm in Athens for a little while,
Okay.
enjoying the summer. It's coming to the end of the summer now, isn't it? So
How Brit are we? Like, we get on here, we don't even get into the podcast, and we're talking about the weather.
I know the weather. It's so gay, isn't it? But yeah, it's coming to the winter. But yeah, I live in Dubai. Basically, 14 years I've been there.
Oh, okay. Tell us though, like, what is it you actually do?
So basically, what we do, Ollie, we help guys, business owners, CEOs, execs, directors, C-level suite guys reduce their high blood pressure, avoid medication, and ultimately live a risk-free life. And that is obviously through training, nutrition, habits, blood work, which where you come into things, and that's ultimately what we do. And we've been doing that for quite a while now.
Okay. How did you get to this point?
Yeah, I mean, so it's funny, isn't it? Because it's quite specific, right? And if you see a lot of guys, they're talking about fat loss all the time and, macros and calories and things. But I've been pretty much doing fitness since I was 18. So it's pretty much all I know. So obviously it's quite a long journey, and I haven't always been doing the blood work, obviously, and
Yeah.
fixing men's high blood pressure. It's been at different stages, but the last, I'd say, 4 or 5 years, it's been helping guys with high blood pressure. Because what I was finding is most of the guys that were sort of coming to us, and we were helping them with their peak performance and getting into shape, but the underlying issue was actually always high blood pressure. So we was like, right, cool, let's just focus on this, help these guys, get them off meds, because obviously there's loads of more underlying issues to that. And then working with guys like yourself, going through blood work and really fixing their optimal health properly. Because as you know, you can't just fix someone's health just from nutrition and training. You've got to understand what they can't see in the mirror, right? Which is through blood work. If someone's trying to give you advice through nutrition and training and they haven't even read your blood work or their team, then they're basically guessing, right?
Absolutely. I would
So
say
you,
test, don't guess.
yeah, exactly. So, and that's why we've gone down that route, and I really enjoy it as well, right? Because you can really dive into someone. They think they're fit and healthy on the outside, but in the inside they're like a rotten tomato, right? So, um, yeah, it's good. It's good fun. That's how it sort of come around, really.
I think as well, there's something that you say there. We think of fit and healthy on the outside, and we
Yeah,
both come from like a competitive bodybuilding physique world.
yeah,
Is that you look shredded, you look great, but on the inside, I wish I
yeah.
had my bloods from when I competed, like
Oh, yeah.
2008 to
Yeah,
12.
that's a good point.
Like, it'd been crazy.
Mine would have been terrible, I think, because I can remember this is going back, oh, it's 10 years now, Jesus. I'm 30, 40 next year. And I can remember I was doing a show in LA at the time, and it got to the point where actually I was walking through the street and I had to like sit down because I was so tired. I was like, this is like so stupid. And testosterone must have been low, energy was low, couldn't even enjoy being in LA.
It's crazy. I remember like my first show. You're so overtrained, you look
Yeah.
shredded, and people are like, I'd love to look like you, and you're like, no, you wouldn't like to feel like me
When I
though.
feel like, yeah.
Yeah, it's like you've got no sex drive. It's you can't sleep. Like, yeah, it's just not good. It's not
Yeah.
good. And
Yeah.
I think that it goes into that if we see people on social media, we don't always see the full story.
No.
And when it comes to men's health, right? How are men coming across when it comes to are they open about this stuff, or are you having to like dig in a little bit to actually get them to start opening up?
And what is I think about men that are really busy? I talk about family men because most, me and you are family men as well, right?
Yep.
Your daughter's what, 6 months,
Six
seven
and a
months
half
now?
months or so, yeah.
Yeah. So I mean, you're quite new to it, but I've got a 5-year-old and a 2-year-old, five and a half, 2.5. So the kind of guys that we sort of help are busy family men, right? So the thing is, we all know, like if I was unhealthy, if you was unhealthy, you know that you're unhealthy. You know how to eat well, you know you got to train, you know what's bad and what's good, right? But knowing is totally different to actually doing it.
Yeah.
Now, when you've got a family, what I find with most of our, patients and students is, um, you leave yourself third, right? And most of these guys are doing that. So, for example, they put their family first and their business, right? Which is, you'd have thought that sounded pretty logic, right?
Yeah.
But you put those two first and put yourself third, then those two things that are first and second, they start spiraling out of control, right? If your health starts coming out of control, not cognitively performing well at work, maybe having arguments with your wife, no sex drive, not present with your kids. So that's what starts to happen. And when that happens, sometimes a little bit too late, Ollie, right? Because I don't know about you, but I'm in a group off subject. I'm in a group on Facebook, right? It's this is, I won't say the name of it, maybe, but the Dubai group. And honestly, there's a guy in there every week saying that they're having a divorce with their wife, like an advice, sort of like an adult business group.
Yeah.
Every week, mate, there's 2 or 3 divorces. The guys are like fucking stressed from maybe work, their health's crap. So everyone knows they're actually spiraling out of control, but they don't do anything about it. And guys don't really say that, right? Especially if I was to meet you now, come to you for help, it takes a long while for a man to say that, right? That they need help. So yeah, you do have to probe, but also you have to meet someone when the time's right for them.
Yeah.
Because you also can't help someone that don't want to be helped.
Yeah, you got to find the right pain point at the right time, and they've got to resonate as well, right?
Yeah, they got to trust you. They got to like you, because as you know now in the industry, it's probably at the lowest trust right now, right? In terms of finding a coach or whatever that might be, business, fitness, whatever you want to do, because there's so many people online doing coaching or trying to pretend they're helping people. There's just so many people doing it, right? Anyone can post something on social media and make you believe it. So it's at an all-time low trust. So you've got to have a track record. You've got to have results. And I think more importantly, you've got to come across as, being likable. Because it's probably the most important thing nowadays, right? Because now with AI and stuff coming out, things are even more automated.
Yeah.
Like people like even sending automated messages. I mean, we're actually going the opposite way. We're doing actually more in-person human stuff and more calls and interaction, because we're just trying to do totally the opposite of what's actually happening online.
I'm seeing it a lot where you can tell people's posts when they're AI, right? And you can tell
the emojis, like the
emojis, the what are they, M dashes? I don't even know how to make an M dash on a keyboard. All those things where I'm like, what? Why are people thinking that we live in a really disconnected but connected, like virtually world? We need to just build up more trust. We need to be more human, and people just aren't seeing that. I think I've seen myself with the business side of things, of that when I talk about stuff that I've been through, how I've gone through it, where I am now, people resonate with that. And it might not be every single person, but we also can't help every single person, right? There's what, 7.5 billion or 7 billion people on this planet. I'd be burnt out if I tried to help everyone.
Yeah, exactly, mate. It's funny you say that, because also when you say the truth online, the people that are actually most in pain actually find it the most offensive.
Oh yeah.
Do you know what I mean? Like if you really string someone's cords, they're the ones that pipe up, right? Or for example, if you say the truth, then people will start being a little bit nasty, right?
Yeah.
It's like I think you seen it the other day, right? Some chick commented on my post, "Oh, you're not in a position to advise people diabetes is this and this and this." And you go into a profile and it's some 60-year-old woman dressed as a witch, right? It's like, yeah, it's crazy, mate. It's probably off topic. We could probably go into the state of the people right now in the world.
Let's leave the politics out of it as such.
Yeah,
but
I know.
Very, very like tempting to post politics stuff, especially today as well, right?
Yeah, it's crazy.
With certain things that have happened, but like there's anger out there. And as you say, when people are triggered, we spoke about a post when someone put a comment in mine. It's like, you're promoting people to be 0% body fat and you're promoting sex. And I'm like, well, you'd be dead if you had 0% body fat. But I'm not promoting that. I'm promoting the fact that if you've got low sex drive, if you're not able to get an erection, that's a sign of something more
to
severe
fix,
going on
mate,
under the body. And also, like, people are having performance anxiety because of that.
yeah,
I was actually taken by surprise when I was posting about low testosterone and people started coming into my DMs talking about erectile dysfunction.
yeah,
Like it took
loads,
me
yeah.
like literally by surprise, and I don't take it for granted when people actually come into the DMs and they talk and they're open about that stuff, because it obviously shows that people aren't talking about it enough.
Yeah.
And I think we need to talk about that more. So we have
Yeah,
high blood pressure.
the ED is pretty quite big actually. It's actually quite in a lot of young men as well, Ollie, I think, isn't it?
Yeah,
Like early 30s even.
yeah, and how much of that is then? I had a podcast. I had Dave Lee and
Oh
Dr.
yeah.
Max Draper on it talking about TRT,
Oh
and we were
yeah.
talking about low testosterone is happening. Like, is it through puberty? And then we look at chemical exposure. We look at how children are being raised, like
Yeah.
with the
Huge.
nutrition, like
Yeah.
the lower exercise side of things,
Yeah, for
higher body
sure.
fat, so more
Yeah.
endocrine
Oh God.
disruptors.
Yeah.
It's crazy. Like, are you seeing blood pressure happening, higher blood pressure happening lower in age groups?
Um, I've not really come across anyone lower than 35, if I'm honest.
Okay.
No,
But
not
what are their
personally.
characteristics though when it does happen? Because I'm assuming it's not always when people are just overweight.
It's not actually, no. I mean, because with high blood pressure, you get a lot of people saying, "Oh, it's hereditary." Like, comes to my mother, and most of the time, I'm quite maybe it's a little bit blunt, but I'm like, well, no, because you wasn't born with high blood pressure, right? There are a few things that, by the way, like 98% of people can fix it naturally and through lifestyle choices, but yeah, for example, you don't always have to be overweight. It can be stress.
Yeah.
You can be quite lean. You can be training. Like you can be overtraining. Like you said, we spoke earlier. You could be quite thin, not fat, but you're under muscled is a big one. Because if you're under muscled, then metabolically you're not very healthy, right?
Yeah.
Low testosterone, high estrogen, and you could also be drinking with that, smoking with that, vaping, sniffing cocaine at the weekend, right? So yeah, it don't always have to be fat, but I will say, 90% of the time, if you get lean and lose weight through strength training, which releases nitric oxide, which then relaxes your blood arteries, and for nutrition, it fixes it. You don't
Yeah.
you don't need medication. You don't need to go to the doctors. Basically, if you go to the doctor, you should. I mean, I'll go into one story. Like we train a lot of guys in America, right? So I hear so many different stories. For example, one guy we go into the surgery. Oh, doctor, I'm feeling a little bit sluggish, a bit tired. Yeah, no worries. Cool. Get yourself on this. I forgot this specific pill, Lamatin or something like that. Lamazin. Yeah, get yourself on this. This will lower your blood pressure. Okay, great. But there's no like. The thing which shocks me is they don't sit there and say, are you exercising? How's your food? How's your stress? How's your sleep? These are things like people think doctors are for, but doctors are actually there to manage your decline.
Yeah.
They're not actually taught to fix the root cause. I don't know if people know that, which actually they don't. A doctor's degree, I think they learn about 2 hours of health and fitness.
The nutrition wise, on average,
Yeah.
there was a study that showed that 70% of doctors had 2 hours or less nutrition over a 6-year medical degree.
Yeah.
And there was a new thing that came out actually, like
I've seen that in America, yeah.
like state to state in America. New York
Yeah.
now have to have 2 years
Nutrition, yeah.
over 2 hours nutrition over 4 years. And I think it's
Yeah.
1 hour in Texas over 4 years,
God,
which
Jesus.
is nuts.
I seen that what's his name, RJK or whatever. He was actually making it mandatory, I think, for doctors to have a
feel it should
nutrition.
be.
Yeah. So that's basically what's happened, right? So they won't fix the root cause, and again, they're there to manage your decline, right? But this is not all doctors, by the way. I'm not tarnishing everyone. There's obviously some really good ones that really go into it.
It's also the system they're in as well. Like,
Yeah, they're taught to medicate you,
Yeah.
and they're taught about medicine, in general. But doctors is a very broad word, by the way. There's obviously doctors for different things, but if you're talking
Yep.
about your general GP, you go in for a little bit of advice. These
Yep.
guys, honestly, 99% of them are donkeys. So they give them this pill, right, for your high blood pressure. High blood pressure might have an adverse effect, might raise your cholesterol. Then what happens? Oh, cool. Take this cholesterol tablet to lower your cholesterol. Oh, okay. I'm feeling a little, again, headaches, sweating, carrying extra weight, no energy. It's all good. take this pill, get rid of your anxiety. So what
Full on
happens is
cocktail.
that, yeah, they're in the system. This is especially in America. They're in like this system. So basically now what's happened is you're um you're a medicated burden to your family. Yeah,
It's
you're on the
crazy.
system. Bang, you're in there. And it's very hard to get out of it because they're just feeding you with drugs.
But it's
That's what.
also, if you look at that system, especially here in the UK, where obviously I'm located, you're from, and the average time for an appointment, like they're targeted at like seven
Yeah,
minutes.
I've heard that.
I
Yeah,
have like, well, the bloods that we've been doing with people has been like 30, 40 minute calls to actually go through. But then
yeah,
your guys are then doing coaching calls off the back of it. When I have my own clients with
yeah,
coaching, like it's an hour onboarding call. And I'm
yeah,
going through so much depth. And even
yeah,
then, it might not be until call 3 or 4 that someone says, "Oh,
yeah,
this happened when I was 25." I'm like, well, why don't you tell me that beforehand?
yeah, yeah.
When
So
there's even that the responsibility to take care of our own health, right? Is that some people, as you say, doctors are there to stop the decline, but doctors aren't responsible for your own health. I'm responsible
exactly,
for my health. You're
can't
responsible
rely
for
on
your
them.
health.
Yeah,
That the buck stops at me.
yeah. Um, yeah, it's yeah. It's. I mean, also what I think it is, Ollie, I think it's a little bit of laziness, right? And looking for an easy way out, right? Take a pill that will fix it. That will keep me going for a little while. Paper over the cracks.
Yep.
Because I can guarantee you, everyone knows what a good food is. Everyone knows you have to go to the gym, right? I mean, we can probably skip all that now, right? We're not here to motivate people. The thing is, it's personal standards,
Yeah.
right? It's not motivation. People don't struggle with motivation. They go to work, they feed their family. It actually comes down to personal standards now, right? And men are just standards is completely dropping. They're happy to have that little barrel, feeling tired, sweaty at work, kids prodding their belly, coming home, sitting on the couch,
It's a
arguing with the
vicious circle,
wife.
right?
Yeah, no
Like,
sex.
yeah.
Um,
That lowers testosterone, but then the lower testosterone promotes more of those behaviors because they're
mm,
not able to have the energy, so we settle for it.
yeah,
And
yeah,
then
and
if you
that's the
think about it
trouble.
as well, right? And we've had the conversation, like my health right now, 6 months into being a dad, is the best shape I've been in my whole adult life,
Yeah, it's
physically and
funny.
mentally.
Yeah,
Not shredded wise, considering the bodybuilding side, but
but yeah,
like
yeah,
I wasn't really an
that's
adult then. I was like
irrelevant.
early
Yeah, yeah,
20s. But
yeah,
like when people say you're not going to be able to eat well, you're not going to be able to sleep, you're not going to be able to train,
yeah. It's
that
nonsense.
still becomes down to a choice. You're not going to train the same,
Mm,
but not 6, 7 days a week, whatever. But should we even need to do that?
mm,
And that comes down to, as we said, personal responsibility. And as you say about the genetics, going back to that, I put a note down here of like people are blaming their genetics, but what
yeah,
actually happens when we do things that our parents do because that's how we were brought up. And
exactly.
genetics are only responsible for 15% of our health. Everything like
Is
there's
that right?
85% is down to our lifestyle.
Yeah, for sure. Makes sense.
How crazy is that? So
Yeah.
what is your actual process when someone comes to you and they're like, "Hey, Rob, I feel your post, got high blood pressure." What happens?
Yeah. So just generally just get on a call with them, right? I mean, best thing to do. We do a high BP health audit assessment,
So what does
right?
that look like?
So they come on the call, find out their condition, bit of past, ask them questions that maybe a doctor should ask them: sleep, how they're eating, their stress, weight. Yeah, because I mean, you can message someone online and they can like your stuff, but you really have to speak to someone, right? To find out what's been happening. Are they smoking? Are they drinking lots?
Yeah.
Um, and then yeah, look, if they feel as though we can help them and with the right team to do that, then yeah, we will um, do their bloods first of all, and that's why we're obviously working with yourself as our functional health medicine doctor to facilitate that. And obviously from the blood work, my team, my coaches will then fulfill the nutrition and the training that's built around their actual blood work, right? Because what I see and what you probably do is just by fixing the gut health can pretty much fix 99% of your problems, right?
Yeah.
Just by fixing your gut health, eating better. But what is really important with people with high blood pressure is what the doctors don't tell them is actually strength training. It's better than running, cardio, because what it does, it releases nitric oxide in the body. All right, nitric oxide is a molecule that relaxes your blood arteries. Okay, even helps with ED, by the way,
Yeah.
like erectile dysfunction, right? Um, like when you're in the gym and you're quite lean and you're pumped, yeah, and your veins, that's actually nitric oxide in your blood, but your body. I mean, you can drink it, can't you? You can take
Yeah.
powder and stuff, but I mean,
I
again,
used to
that's
always
just
think nitric oxide and think Fast and Furious.
did yeah, yeah, make me go faster in the gym.
Yeah.
Um, but yeah, strength training. But look, I mean, we can sit here and say, oh, we do this nutrition for them, we do this training for them, but it's all going to be different based off of the readings you get, right? Like you said,
Yeah.
you might have to fix a bit of gut health before you eat this kind of food or before you train this much. You might have to fix stress and cortisol before you put someone on a 4-day split, or you're going to put them on a 2-day training schedule. How high is their cortisol? And so it really depends what starting point they're from, right? And as I was saying to you before, you can't sort of how you might feel good, you might feel you haven't got the symptoms of high blood pressure, but until you do your blood work and see what's going on, because you can't see that in the mirror, right? And
Mhm.
you got no data to go off. Your blood is pretty much the data to your health and fitness.
Yeah.
So yeah, we basically go off that, mate. And yeah, and
I
I'm
think with
glad you
any
sort of come
blood
on board
work,
to do it.
like with any, you can't lie about blood work. You have your bloods done, and it
That's
tells
another
you there
point.
in
Yeah,
black and white.
yeah.
People can't tell you they feel good when their bloods are coming back, and you can
Well,
tell
that's what I
you
like to
know they're
do
not.
with someone's ego. We have a guy. He thought he was a little bit like, "Oh, yeah, I'm all good. Like training's
Yeah,
good. Sex drive's fucking bang on. Like he's a bit of a business owner, and he wouldn't listen to any of our. He wasn't listening to sort of any of our coaching. Right? He was like, just felt he know it all. I was like, okay, okay. And I said, right, okay, what we're going to do with this guy? Because he didn't do his bloods at the start because he didn't have high blood pressure. Obviously, take on other guys that want to improve their body comp, right?
yeah.
So he wasn't a high blood pressure patient. But after all these back and forth, I was like, right, cool. Let's just the way we're going to sort of help this guy and help him realize that he does need help is let's get his bloods done, right? So boom, does all his bloods. Oh, triglycerides are high. DL's a little bit high. Testosterone's a little bit high. Oh, your cortisol a little bit high there. Look, and he was like, it really just like pushed him back, educated him. It
Yeah.
wasn't for me to be sort of pushy or nasty about it. It was just like, right, cool, get your bloods done because I know for a fact you do need to fix some things. So yeah, that really helps people. And if you do ever have a person like that who's a bit of disbelief, the bloods just sort of read it all out for you, and then you've got some things to focus on with your health. It does give you a bit of motivation
Yeah.
because he doesn't want all them high readings. He's got like 3 kids. He wants a full healthy blood panel, right?
There's a few people that I'm like, I want to do bloods with them, or they've been a client and then they've stopped and they're like, can I do my blood 6 months later? And I'm like, mate, you've implemented nothing, like kept the things we're doing, you've not kept going at all, have you? How do you know that?
Right.
I was like, because of your bloods.
Yeah.
We went so like we got the testosterone from low to high, like good, like high normal, and then it went back down again. And it's about we have to push. Like if you build a business, you have to then build up the foundations and build up the solid team around you to keep that progression going, right? You can't just then just build it up and then just step away completely without the foundation, the like solidarity in place. You need the team, you need the other leaders in there, and that's where just building sustainable methods. And
Yeah.
like we've both come from that background where no doubt when you competed, we'd have an on season, we'd have an off season, and like I was saying to my friend the other day that I can't believe that I used to get in such bad shape in the off season and then just completely smash myself for like
Yeah.
19, 20 weeks to get shredded.
Yeah,
And
that's a
then I
big
would try and
error.
stay too lean sometimes in the off season, just be overly stressed. There was nothing sustainable about it, but we
No.
have to build sustainability into where we are with the people we're working with.
Yeah. Exactly.
Like those
Exactly,
methods
mate.
don't work. So tell us like where can guys find out more about what you're doing?
Just go over to my Instagram, Rob J Sharpe. That's pretty much where I post all my content, and then I have began in the last 6 months posting more on YouTube at again Rob J Sharpe.
Yeah.
Because what I find on YouTube a lot is you can actually educate people a little bit more. It's more longer form. Because as
Yeah.
you know, on Instagram it's like 60 seconds, 90 seconds. You have to sort of kind of hook someone in. you know, you have to go down that route. Whereas on YouTube, you can come across a lot better, and you can educate people. So you definitely need a longer form platform to reach people that are going to listen to your message, right, and help more people. So yeah, YouTube or Instagram, really.
I've been doing that with like 10 to 15 minute masterclasses on YouTube,
Yeah,
and then just telling people about them on Instagram. Be like, hey, look, you can learn more
exactly,
information
mate.
by
Yeah,
DM
yeah,
me this, and then I'll send you the link to it. So guys, you
exactly.
can go on like your Instagram, drop you a message. They've got problems with high blood pressure, or they feel that they might have problems with high blood pressure and want to investigate a little bit further. They've been frustrated with the doctors not taking them seriously, and they can go and get in touch with you.
Feel free. Yeah, DMs are open. You'd have to join the program. DM me. I always answer my own DMs, and yeah, we can point you in the right direction.
It's good. And anything else that you feel that the viewers need to know before we head off?
I think we've covered it enough, haven't we? Enough to get on, especially that topic. Maybe we should set up another podcast for maybe testosterone or something like that, right? Because there's
Yeah,
so many different avenues you can go down, isn't there? Like the TRT, your testosterone, your cortisol, your cholesterol, which is a bit of a myth. People think if you have high cholesterol, it's really bad, isn't it? It's
yeah.
demonized, isn't it? Cholesterol now.
I
So
did
maybe we
actually
should
tell a
set.
client that I
Did
wanted to
you?
punch a doctor in their face for
Oh,
prescribing them statins the other day. They were my exact words,
yeah.
and I'm like,
Wow.
so we need to do something on that. So let's
Yeah.
make the commitment here. We're on the recording now that we're going to
Yeah.
do some regular podcasts, maybe like one a month or something that we actually just get information out. If there's a
Yeah.
topic people want to cover, they can DM you, they can DM me,
Yeah.
and let's just get that conversation going.
Yeah, because I appreciate it. Now, as you know, I don't know if the guys know, but obviously, we've been working together, and you're on our pretty much on our team doing our blood work. So, any questions I get on blood work, we'll shoot maybe a 15-minute pod on a specific topic and go all in on, like you said, cholesterol, um, cortisol, and just use one little topic and really delve into that one
Absolutely,
nugget.
let's do that.
Yeah,
Rob,
that'd be fun, mate.
thank you so much for joining me here, and hopefully the guys have got some value from it.
Yeah, hopefully, guys, take care. Cheers for having me on, Ollie.
Cheers.